Welcome to Raaonline. I am Dr. Sudakshina, Professor of Anatomy. Today we are going to take the anatomy of scalp. We are going to discuss about that. It's a clinical problem-based question. It is an essay question in your any kind of like definitely in first year anatomy, and also it is a repeated essay in other universities too. Okay, so coming to the question as such, a 17-year-old boy comes with profuse bleeding from scalp laceration due to blunt force injury to the head. So, as we know that scalp anatomy is different from other places anatomy, and mostly the scalp laceration can happen due to a blunt force injury to the head, or it can be due to a fall, or it can be ward injuries, it can be because of cracking of bottles and all that. So now we are coming to the question as such. So describe the scalp under the following headings. The main headings under which you will be writing the scalp essay are extent of the scalp, the layers of the scalp, the blood supply, the nerve supply, the clinical anatomy. So clinical anatomy becomes a very important part in the scalp, because the scalp anatomy is little different from other anatomy. Okay, so now let's move ahead and start with the question answer per se and the extent of the scalp. So let's see. So this is the main topics under which we will be discussing the scalp. So coming to the extent of the scalp, scalp is a soft tissue which covers the skull vault. So it is a soft tissue which will be covering the vault. So we have the vault something like this, and definitely it is a tissue which will be covering the skull vault. So the skull is a bone. Above the bone you have the soft tissue. And coming to the extent of the scalp, so we have anterior extent. So anteriorly the scalp will extend up to the eyebrows or the superciliary arch. Posteriorly the scalp will extend up to the superior nuchal line, and laterally the scalp will extend up to the superior temporal line. So let's see the extent in this diagram. So this diagram is showing you the extent. So you can see over here, this is the anterior extent. So anterior extent of the scalp up to the superciliary arch. So this is the superciliary arch. This comes your posterior extent. So this is your posterior extent of the scalp, which is up to the superior nuchal line, and also the external occipital protuberance is coming over here. So that is in the center, you have the external occipital protuberance. So this is your posterior extent, and if you see the lateral extent on either side, so the other side also, this becomes the lateral extent, that is the superior temporal line. So when we do the osteology sessions, we are definitely going to show you where exactly the superciliary arch is there in the skull. But as you can see in this diagram, approximately the scalp is extending up to the superior nuchal line. So this is not scalp. So this area is not scalp, and the forehead is included in the scalp. That is what you have to remember. So our forehead is included under scalp. So forehead comes under scalp. So remember that this is very important analysis, and then this is not scalp. Below the external occipital protuberance, it becomes nape of the neck, and it is not scalp. Okay, so this understanding is very important in understanding the extent of the scalp. So now once we go ahead and just go through the extent once more. Okay, so this is the extent of the scalp. So anteriorly it is up to the eyebrows. So basically the superciliary arch is corresponding to the eyebrows or just above the eyebrows. So that is the anterior extent. Now we have understood that very well from the diagram. Coming to the posterior extent, it is the superior nuchal line. You have seen that it is above the ending of the hairline. So the hairline will actually go beyond the superior nuchal line. It will be much below. It will actually extend up to the nape of the neck. Next is the laterally you have the superior temporal line. So definitely it is not extension, and the, below the superior temporal line it becomes the face. So these are certain things which we have to remember when we tell the extent of the scalp. Extent of the scalp will carry marks. So you have to write the extent properly when extent will be asked in the question. Okay, now let's come to the other part of the answer of the questions. We are talking about the layers of the scalp. So you have the skin, that is the first layer of the scalp when you come from superficial to deep. Then we have the connective tissue, then we have the aponeurosis, then we have the fourth layer or the loose areolar tissue, and P is the pericranium, which is just above the skull bone. So now the thing is, how do we remember this? It is very easy to remember. Just remember the mnemonic, that is the scalp. So S stands for skin. Then we have the connective tissue just below the skin, and then we have the aponeurosis. It is also called the gallae aponeurotica, with the occipitofrontalis muscle, and occipital belly and the frontal belly both are coming. So I'll be explaining that in detail, and you also have to draw the diagrams in your question when you answer the question in your exam. And then you have the fourth layer is becoming the loose areolar tissue and the pericranium. Now if you see these three layers, that is the skin, the connective tissue and the gallae aponeurotica or the aponeurosis, okay, with the muscle bellies. These three layers are also called the surgical layer of the scalp. So surgical layer of the scalp. Why is it called surgical layer of the scalp? Because so these three layers together is the surgical layer. So when you try to move the scalp, you will be moving the scalp on the loose areolar tissue. So these three layers are kind of fused with each other. So these three layers are considered together and they are fused with each other, and these three layers together is called the surgical layer of the scalp. Now this has to be very clearly understood, because these three layers are going to move on one loose plane, which is the fourth layer of the scalp, and that plane is actually movable, and that is the loose areolar tissue. Okay, so we will come to each layer. We are going to discuss about the each